Thank you very much, Mr. Speaker. It's my pleasure to enter into this debate today to talk about the budget that was presented to us last week and to give some insights on this important day. The government likes to say that the budget is balanced, Mr. Speaker, but the budget isn't balanced when it adds $1.8 billion to debt this year. They've tripled the debt, they've doubled the take on the PST and flattened the economy, and their cuts are hurting our kids in the classrooms. They like to talk about how there's record spending in health. Sure, they're patting themselves on the back, but the spending isn't keeping pace with what is needed. There's a drop in the bucket for the necessary spending on health capital. It's 3% of what's needed for health infrastructure, Mr. Speaker. We don't see any smart front-end initiatives to get emergency department waits under control. And as far as mental health goes, I'm proud to be part of a caucus with the first mental health and addictions critic and someone who has worked very hard. I'm talking about my colleague from Saskatoon-Riversdale, has worked very hard to bring these issues to the forefront. There have been a number of concerns that have been brought forward, and we had people in the legislature week after week after week in the fall session to share their stories. So I'm glad to hear that the government is listening to that part, but we are still catching up to other provinces. By no means are we leaders on this front, Mr. Speaker. So let's go into some of this in a little more detail. So overall, the fact that the debt has tripled, Mr. Speaker, is very disappointing in a year when the government's going to say that they have found the right balance. The right balance under what circumstances, Mr. Speaker? We've increased the debt by $1.8 billion this year. It was $7.9 billion in 2009. It's going to be $23.1 billion in 2021 and projected to be $26 billion in 2023. That's not strong fiscal management. There's no balance in a budget that piles on billions of dollars of new debt and puts our Crown's futures at risk. Year after year, we've seen deficit after deficit from the Sask Party government, and their razor-thin surplus this year could easily be wiped out by supplementary estimates. As we see year after year that they've been unable to adequately account for the extra money that's going to be needed in health utilization, in social services utilization. And the government comes in the middle of the year and asks for more money in the terms of supplementary estimates, and then we can see that this budget could be wiped out, the surplus could be wiped out very quickly under these circumstances. They've doubled their take on the PST and flattened the economy. Life is a lot more expensive now, Mr. Speaker. The average family is paying $778 more in PST a year since 2015. Households are suffering. Housing markets are in the dumps with the highest numbers of foreclosures since the early 90s. Homeowners are struggling to make ends meet. There's been a 200% spike in home foreclosures since the Sask Party formed government. People can't afford their houses, Mr. Speaker. If this doesn't say something about the cost of living increasing, I don't know what does. There's no balance in a budget that keeps people out of work. We have a plan on this side of the House to create thousands of jobs through Renew Saskatchewan, and I suggest that that is something that the members opposite will take a look at. They're hurting our classrooms, Mr. Speaker. We heard about this at length today when the member from Regina Lakeview stood up and asked a number of questions in question period about these decisions that directly impact the kids in our classrooms. And we're talking about early childhood education right up to post-secondary. It's incredibly short-sighted. I heard on the radio this morning someone talking about it being short-sighted, and classrooms are still feeling the squeeze when they've already been starved of the resources they need and deserve. This budget only adds $16 million to school operating funding, which is a drop in the bucket. Classrooms have been neglected during the boom, times of record revenue that have been coming in. They were hit with a cut of $54 million in 2017. At the same time, schools have grown by 7,000 students. Teachers are dealing with overcrowded classrooms, tight resources, and complex needs, and students are left without the supports they require, Mr. Speaker. We've seen the Sask Party disrespecting crucial education partners like teachers and school boards. Sadly, this budget is not working to repair the damage that's been done. And I think that everyone should look closely at what the per capita funding per student is to see that this budget simply is not keeping up with the pressures, with cost pressures and population growth. So we're talking about cuts that haven't been restored. Per student funding is hundreds of dollars lower than it was before these cuts, which is putting incredible pressure on our classrooms, Mr. Speaker. We're calling for the Sask Party government to be honest with Saskatchewan people about the consequences of their budget choices, to invest where it counts, to make front-end investments, to scrap the PST on construction that has damaged the industry and the economy, and to invest in our classrooms and see these as an area to make smart investments because of the benefits that will come later on. When we talk about the health budget in particular, Mr. Speaker, you'll know that I'm the critic for health, so I've taken a keen look at the health budget and want to make some remarks specifically on that front. This budget represents the bare minimum of spending to be able to keep up with cost pressures. They're falling short of what's needed. When you take mental health out of the equation, we're actually seeing less than a 2% increase in health dollars when we should be seeing a 4 or 5% increase when you factor in population growth and cost pressures. These pressures include population growth, they include an aging population, wages and salaries, and increased utilization as well. So they're falling short of what's needed, and this is a pattern, Mr. Speaker. It's routine behavior that the government asks for more money for supplementary estimates. We can see it or in special warrants for funding. It shows that the budget is imbalanced when they have to keep going back asking for more money. And according to CIHI in 2017, when you compare Saskatchewan to the other provinces, Saskatchewan has the smallest percent increase in health spending at 0.2% per person growth of all provinces. It's a drop in the bucket for spending on health capital, Mr. Speaker. They're spending $103 million on health infrastructure when there is an infrastructure deficit that has ballooned to $3.3 billion, Mr. Speaker. That's 3.12% of what's needed. 3%. At this rate, how can they expect our health facilities to stay open? How can they expect that they won't be crumbling and have to close? They need this money in order to be able to be improved. We are nowhere near keeping pace on health infrastructure, and government still isn't being transparent on this. Where is the priority list for infrastructure spending? Do they have one? Are they following that priority list? What's up next for builds and repairs? There's no transparency on this front. We still haven't seen the long-term care facilities that were promised in the 2016 election. There's no money for Grenfell long-term care that was announced, so I guess that means that it's going to be a private build, Mr. Speaker, and that they haven't been listening to the folks who came to the legislature here to raise concerns about what this means for access and what it means for quality of care. And we don't see investments in the front end to get emergency department waits under control. There's $1.6 million increase to the Connected Care strategy for a total of $20.6 million. It looks like this money is going toward home care, Mr. Speaker. But last year they put $19 million of federal money into the Connected Care strategy. And what was the result? As the ministry officials shared with us at the Public Accounts Committee, wait times are similar or higher on all 4 measures that are used. They haven't come remotely close to realizing their goal of a 35% reduction on wait times. And this doesn't appear to be a priority to get these costs under control. We aren't seeing the budget dollars going in that direction whatsoever, Mr. Speaker. It's their own goal, and it's one they've adjusted repeatedly. First, they wanted it to be down to 0 waits. Then they asked for a 60% reduction. They were trying to get there. Then they moved the goalposts again. Maybe we can get to 35%. And they're not succeeding, Mr. Speaker. We're all suffering, waiting in emergency departments. Our families are suffering. Our communities are suffering as a result of this government's inability to get this under control. They base these numbers on 4 sets of emergency department performance. How long you wait to see a doctor from when you arrive, how long you stay whether you're admitted or not admitted, and then how long you wait for a bed if you are staying. So this ministry's goal was to reduce ED waits by 35% by March 31st. So how many days do we have left to get there? It's the 25th right now, so we have 6 days in order to be able to get to that goal. We are so far from getting back to that 2013-2014 baseline, Mr. Speaker. 1.6 million being added is a start. Home care keeps people close to home. It's one way to impact emergency department waits, but it's sadly not even close to being enough toward the effort to enhancing team-based care in our communities. Community supports are paramount. We need connected hospital care, calm care, and quality transitions. So, other areas that we talk about in terms of the health budget, Mr. Speaker. We see that autism funding increased, the individualized funding from $4,000 to $6,000. This is good, but it still only applies for diagnosed kids under 6 years old. So I know there are a number of folks who feel like they've been left out of the equation. They've come forward since the budget. We've had conversations with those folks as well, and it's really disappointing to see that it's such a small group of people that will benefit from this funding. There are a number of other models that other provinces are employing that folks on that side of the House should be looking at. We're 2 years into the amalgamation of the Saskatchewan Health Authority. We are promised savings. We were promised millions of dollars of savings, 20 million at one point, then they cut it down to 10 million last year, but we're still looking to see where those savings are going to materialize, Mr. Speaker, where we're going to see them. So I'm still looking and hoping to see something from that, because it sure puts people through a tremendous amount of change if we're not actually going to see any material benefit for that change. There's funding toward an organ donor registry, but what about investing in donor physicians? As we heard a tiny bit about last year, Mr. Speaker, a proven evidence-based way to increase the number of donors. There's funding for the First Link program, which I know was a key initiative of the Alzheimer's Society. It's a great initiative, helps folks get connected, helps family supports get put in place, and this should make a significant impact on families. I know this is what they were asking for. We're certainly happy to see that those supports will be in place and that families will have access to those resources. Mr. Speaker, I understand it's being spread throughout the different areas of the province now. Health CBOs are being offered 1% this year to go into salaries. This is really an area that needs investment, that we have been calling for investment, Mr. Speaker. These folks provide critical supports, and this is not enough, Mr. Speaker, for the critical supports that are being provided here. There's a funding increase to account for more doctors, nurses, and staff at the Children's Hospital in Saskatoon. This is certainly welcomed and required, Mr. Speaker. We know there are tremendous challenges with the current state of staffing right now. $1.4 million toward Saskatoon Hospice. Again, we've heard folks in the community calling for this, Mr. Speaker. $700,000 for a satellite dialysis unit to accommodate patients in Meadow Lake. $100,000 towards 24 physiotherapists, occupational therapists, and nurses in complete decongestive therapy for what will impact about 30,000 people with lymphedema in Saskatchewan. And the Sask Cancer Agency getting $8 million in new funding to support oncology drugs and recruit additional oncologists. When we talk about mental health, Mr. Speaker, we are pleased to see these targeted investments for mental health. Many of these areas are things that we have been calling for several years, and folks in the community have been calling for. It's a start, but we are so far behind what other provinces have been doing, Mr. Speaker. We've also called for the permanent mental health unit in Saskatoon, but funding provided will only offer a short stay unit of 7 beds for a 7-day stay. There's federal money toward an opioid plan. The Sask Party government has folded crystal meth into this approach, we've heard from the minister, but we haven't seen a concerted plan on behalf of this government. We haven't seen dollars matched, anything going into that from this government. So there are many other areas that we need to see investments on, and after coming out of this time of record revenue, it's so disappointing to see the areas that have been cut, Mr. Speaker. We've heard about some of those cuts today. I know my colleagues are going to spend a lot more time looking into each individual area, especially the areas that fall into their critic portfolios, to show the ways in which this government has squandered a decade of resource revenues, Mr. Speaker. I'm prepared to say that I can't support the budget motion, and I'll be supporting the amendment that was moved by the member from Regina Rosemont, Mr. Speaker.
Hear, hear.